Hi guys, Stanley Keys here at Optometry Evolution again. Last week I looked at the topic of red eye just in terms of helping to triage these patients. This week I thought it might be useful to look at the topic of reduced vision or visual loss for patients who may be contacting concerned about reduced vision. So we're just going to run through again a bit of a checklist of the sort of things that we want to think about and ask whenever the patient phones. First of all, we get the patient details, and namely the age is of interest clinically. Most sort of reduced vision will occur in sort of older patients, but obviously not exclusively. Probably the number one question on my list is the onset of symptoms. Has it been a gradual change over the course of sort of weeks or months, in which case we're probably a little bit less concerned, maybe something like dry macular degeneration or cataract, something like that is at play. If it's been more rapid and more progressive, then we're obviously a little bit more worried. So if it's been a change over a few days or maybe a week or two, then we're thinking of something a little bit more progressive in terms of the mechanism for that. Often patients will be able to pinpoint when the vision reduced and say, you know, they woke up a couple of mornings ago and the vision was gone in one eye, in which case we're thinking of a distinct event such as an arterial occlusion or anterior ischemic optic neuropathy, for example. So think about the onset. Second thing is to try to get some sort of handle on the extent of the visual loss and the nature of the visual loss. Obviously, you know, you're not able to do a Snellen test on them, the patients at home, but maybe ask them to cover the fellow eye and just even describe what they're seeing or what they're not seeing. Is it down to just sort of darkness and shadows and movement? Or is it just more modest loss where they're maybe not able to see the print on their television? If you can get some sort of description of the visual loss, that would be really good. Is it just central visual loss, so thinking more along, you know, the macula being affected, or is it sort of wider? Is it the complete sort of visual field which is affected? They may also describe that it's just maybe the upper hemifield or the lower hemifield, in which case, you know, we might think about a retinal detachment or a branch vein occlusion, branch retinal artery occlusion, and these types of things. So try to get some sort of description of the nature and extent of the visual loss. You also want to know if they've had any pre-existing eye conditions. So do they have a history of wet macular degeneration? Maybe they've been getting injections at their local ophthalmology department, for example, glaucoma, previous retinal detachment, these sorts of things we want to know about. Have they had any recent eye surgery? So maybe they've had a cataract operation 4 weeks ago. You know, this could be something like cystoid macular edema, which is now sort of coming into play. So ask about any previous or recent eye surgery. You also want to know if they're myopic, you know, thinking along the lines of maybe risks of detachment or choroidal neovascular membranes, which can occur in myopic patients. Next on the list is to ask about their sort of medical background. Are they diabetic? Do they have sort of very high blood pressure, high cholesterol, other sort of cardiovascular risk factors? Are these things well controlled? Are they on medication for them? Do they smoke, for example? So things that may sort of point towards more sort of cardiovascular based conditions such as a vein occlusion, for example. So get that sort of background information. The next thing you want to move on to is to ask about sort of associated symptoms. The first on my list is to ask about distortion. So if somebody's got reduced vision, particularly if it's central, is that vision distorted as well? So if they look at a straight line, such as a door frame or a Venetian blind, are they getting wavy lines? So again, thinking along the lines of macular changes, such as wet macular degeneration, for example, or macular edema. Is there any pain associated with this reduced vision? Not many conditions will give you pain and reduced vision. Perhaps an injury will, acute angle closure glaucoma certainly will. Optic neuritis might, it'll give you pain on sort of eye movements and things, orbital cellulitis if there's reduced vision. So ask if there is any sort of pain or discomfort associated with this reduced vision. Next on the list is to think along the lines of our sort of retinal detachment type patients. So asking about flashing lights in the peripheral vision, any recent onset of floaters, any sort of dark shadows in the vision, and particularly in the periphery. Patients may also describe kind of shimmering sort of visual disturbances as well in the peripheral vision. And again, these sorts of things can point towards maybe a tear or a detachment of the retina. Next on the list is to ask if the patient has been unwell in themselves. Any associated headache, for example, again, might be associated with something like acute angular closure glaucoma, particularly if they're vomiting and feeling sort of unwell in that regard.